Hello, everyone. Welcome back. We're going to get started in just a minute as people are resuming and rejoining. We're approaching 100 of our 200 plus, and we'll get started shortly.
So we are back at about 112 or so, Dr. Jones, if you want to, well, it's rising, 120, 116. So whenever you're ready.
I'm going to wait one more minute. Let's see, because what I know I'm going to do now is I'm just going to, I'm not going to tell the full Gartner's tale, but I will refer people to where they can find it. Because I do want to share some of the other stuff, and we do want to have a lot of time for discussion. And I know people have budgeted to 11:15 for this, and so I know that we can't go over. So that's what I'm going to do. But if I can just wait and find out, how many people do we have now in Zoom land?
About 125, 6 is growing.
Okay.
And just know we'll be sharing lots of resources. So whatever you want to share at the end, we'll make sure everyone gets that. So no problem there.
So let me start again. And of course, this is being recorded. Is it being recorded?
It is. Mm-hmm.
Yes. So then people who are getting on later can at least pick that up. So that was a startling interruption. And we don't know, nobody on the team knows why that happened with our Zoom link. That hasn't happened before. So our apologies for that sudden thing. And I hope it wasn't a Zoom bombing type of thing. Anyway, I was still on the definition of racism, and I was talking about how racism does sap the strength of the whole society, and that Black lives are not just precious. I mean, they don't just matter, they are precious, and that racism is sapping the strength of the whole society through the waste of human resources. And before I leave this slide, I just want to say one more thing that I've learned over time, and that is that there are many people in this country who think there are two states of being, that there's disadvantaged and then there's normal. And the reason that people think that the two states of being are disadvantaged and normal is that we as a nation are ahistorical, and people do not understand that their so-called normal is built up on a whole mountain of unfair advantage. I was going to spend quite a bit of detailed time describing 3 levels of racism that are quite useful to think about when you try to figure out how is racism turning into more of our babies in some communities and others dying before their first birthday? Or how is it turning into more of our women around childbirth, what's supposed to be one of the most beautiful times of life, dying in relation to that, the maternal mortality rates, which depending on where you are in the country, for Black women or indigenous women compared to other women could be 3 times, 4 times, in some places 8 times as high. How does racism turn into high blood pressure, or diabetes, or kidney failure, or lung disease, these things which right now, if you get COVID-19, are making you more likely to die from COVID-19. How does racism turn into health outcomes? And it's useful to talk about these 3 levels: institutionalized, or what we now call structural racism; personally mediated, which some people call interpersonal, but because I do understand racism to be a system, I call it personally mediated because it's the system mediated through people. And then internalized racism. I'm just going to kind of very quickly go over what these levels of racism are, defining them, and how they can impact health. But if you want to get a deeper dive into that, then you could look at the 4-page paper, which is actually referenced at the bottom of these slides, or you can even Google Camara Jones Gartner's tale. And I would suggest that the first thing that you look at is the nicely edited video of me from 2002, where I talk about these levels of racism in more detail and actually tell the Gartner's tale. So institutionalized racism, that's the system. It's the constellation of structures, policies, practices, norms, and values, which taken together result in differential access to the goods, services, and opportunities of society by race. This is the kind of racism that does not require an identifiable perpetrator because it's been institutionalized in our laws and customs and background norms. It shows up as inherited disadvantage, or its reciprocal inherited advantage. We see it in terms of material conditions and access to power. including differential access by race to quality housing, equal educational opportunities, equal employment opportunities, same level of income even at the same level of employment. And those things clearly impact health, differential access to medical facilities, including linguistic access, differential access to a clean environment, and the well-described and well-documented disproportionate placement of toxic dump sites or bus transfer stations or the like in communities of color. And in terms of power, differential access to power as information, including information about our own histories, differential access to power as resources, not just capital money resources, but social networking resources, and differential access to power as voice in government, in media, and the like. And the whole effort to suppress our voice in government right now, to suppress the vote, is an important thing. I just want to quickly say that sometimes people ask me, why do I have housing, education, employment, income on my slide about racism? Because isn't that actually what we call social class? The quick answer to that is, it doesn't just so happen that people of color in this country are overrepresented in poverty, while white people in this country are overrepresented in wealth. That's not just a happenstance. And for each marginalized or stigmatized or oppressed group of color, there's been some initial historical injustice. And I usually detail for 6, 7 groups, but I don't have time now. But there is some initial historical injustice, which is not just in the past. It is not irrelevant right now, because each of these initial historical injustices are being perpetuated by present-day contemporary structural factors, where those present-day factors are part and parcel of institutionalized or structural racism. So when you ask, are you talking about racism, or are you really talking about social class? My answer is that structural or institutionalized racism explains why we even see an association between social class and race in this country. That's a very important aha. And that is not to say, some people say, well, you don't seem to care about poor white people. I care about poor everybody, poor white people, black people, Latinx people, Hispanic people, so Asian people, indigenous people, Native Hawaiian, other Pacific Islander people, all kind of people. And we need vigorous anti-poverty strategies. But if that's all we did, even if we were to equalize income today, and you will note that most of the vigorous anti-poverty strategies are not talking about equalizing wealth. That's what we really need to do. That's the reparations argument. And even if we were to equalize income today, if we didn't address racism and structural racism, within one generation, we would start to see a stratification by race again in terms of income. So it's not that we have to choose, are we anti-poverty or are we anti-racist? This is a both-and situation. And also on institutionalized or structural racism, we have to recognize it can be through acts of doing, acts of commission, as well as acts of not doing, acts of omission. And very, very often, this is a hallmark, structural racism shows up as lack of action, inaction in the face of need. The second level of racism, personally mediated racism, I define as differential assumptions about the abilities, motives, and intents of others by race, and then differential actions based on those assumptions. This is what most people think of when they hear the word racism. Somebody did something to somebody. It includes the different idea, the prejudice, and the different action, discrimination, many ways that it can impact health, police brutality, physician disrespect, physician not giving a patient the full range of treatment options because the physician figures that patient wouldn't understand or couldn't afford or wouldn't comply or whatever they assume. Could also be quite blatant, like sterilization abuse, which has had many iterations in our nation's history. Shopkeeper vigilance, not getting, or waiter indifference. These are like everyday racism. Teacher devaluation, where a child once put off in the ADD track won't even know their full potential, much less have the opportunity to develop to their full potential. And this level, like the structural or institutionalized racism, can be through acts of doing as well as acts of not doing. But even more important is to recognize that this level can be unintentional as well as intentional. You do not have to have intended to do something racist to have had a racist impact. Internalized racism, here I'm defining from the point of view of members of stigmatized races as acceptance by members of stigmatized races of negative messages about our own abilities and intrinsic worth. I also recognize that the internalized sense of entitlement that many white people are walking around with is also internalized racism, but I do not understand how that could turn into bad health outcomes, except maybe a sense of entitlement thwarted is turning into what is now being described as the diseases of despair in white populations. It's that thwarting, I think, of the sense of entitlement that's there. But here, from the point of view of members of stigmatized races, internalized racism turns into self-devaluation, feeling maybe I really am not as good as. Maybe I shouldn't try to graduate from high school or apply to that college or try to get that job or live in that neighborhood. The white man's ice is colder syndrome, that phraseology from my parents' generation still has meaning for many of us today. So say I'm Black and I need a lawyer, I might seek out a white lawyer over a Black lawyer. Or maybe I'm sick, I might prefer the white doctor over the Black doctor. Or maybe my lemonade is warm and I go way down the street to get the white man's ice over the Black man's ice, deeply believing that the white man's ice is colder, deeply internalizing the myth of white superiority. And this level of racism internalized also turns into resignation, helplessness, hopelessness, which turns into a lot of self-destructive health behaviors, turns into not registering to vote or not voting even if you are registered. And people, we cannot do that today. There are many people trying to take our vote away from us or make it very difficult or lock us out or, make the lines crazy or give us COVID, right? And so what we need to do is we need to, all of us, make sure that we do everything we can to ensure that as many people as possible can vote. That actually includes the HEROES Act that was passed by the House needs to be at least considered by the Senate. So all of us need to at least reach out to our senators and say, please at least consider this, which is trying to support state and local governments to enable them not only to don't shut down the schools or, don't hurt the schools anymore, but to support efforts to make it possible for as many of us as possible to vote from home, because you see, COVID-19 is not going to dip any kind of soon. We have this tidal wave now rolling across the country in a slow wave. And so it's going to be as many people as possible are going to have to be able to vote from home, as well as others who prefer to vote early or on election day. All of it has to be open. Anyway, back to internalized racism. Basically, it's about members of stigmatized races accepting the limitations to our own full humanity of the box into which we've been placed. So here, I'm going to stop sharing for a minute to just quickly share my gardener's tale. And then, I am feeling quite time pressure because I'm so interested in the questions we're going to have, but then I'll jump back. You're going to have, after this gardener's tale, I'm sure, Robin, you're going to have another question for me, but I'll try to hit that really fast too.
Okay, but don't worry about time. You go ahead.
Okay. I am worried about time. That was quite an interruption. It was odd. Anyway, there it is. So, for this gardener's tale is another one of my allegories where I it's based on something from my own real life. So this story is to illustrate these 3 levels of racism and what we need to do. But let me start with what I saw with my own real life. So my husband and I had been married for about a year. We moved back down to Baltimore, where I was going to finish up my PhD. We bought our first freestanding house, cute little house, big wraparound porch with flower boxes dotted all on the porch. And it was October, so we didn't plant right away. We waited till spring. But when spring came, my husband, who loves to garden, ran out to decorate our cute little house with our marigold seed, right? But then he came right back in. And he said, Camara, some of these boxes have dirt, but some of these boxes are empty. I need to go to the gardening store. So that's what he did. He went to the gardening store and he hauls back big old bags of potting soil. And then we fill up the empty boxes. And then we take equal numbers of our marigold seeds and put them in all of the different boxes. And we, water all of the boxes equally. And by this time, because I am not the gardener in the family, I'm exhausted, right? So I decide I'm just going to sit back and see what happens. Well, 3 weeks later, I'm walking out of my front door and I finally pay attention to these flower boxes. And what I saw made me literally stop in my tracks. Because what I saw made me think we had planted completely different species in some boxes versus the others, because some of the boxes were full of plants and the plants were tall and vigorous looking. And some of the boxes just had a few plants in them and they were scrawny and scraggly looking. And then I realized what had happened. That potting soil, which my husband had brought, was rich, fertile soil, so that every single seed planted in the rich, fertile soil had sprouted. And the strong seed had grown very tall and vigorous, but even the weak seed had made it halfway up. But that old soil that we had found there turned out to be poor, rocky soil. So the weak seed planted in the poor, rocky soil just died. And even the strong seed in the poor, rocky soil had to struggle to make it to a middling height. And maybe some of you listening are gardeners yourselves. And maybe you've composted half of your garden. So maybe you've seen this image with your own real eyes. And the image, of course, is about the importance of the soil, the importance of the environment. But now I'm going to take this image and I'm going to make it a story about racism by introducing a gardener. So here we have a gardener who has 2 flower boxes, one which she knows to have rich, fertile soil, one which she knows to have poor, rocky soil. And she has seed for the same kind of flowers, except some of the seed is going to produce pink blossoms, and some of the seed is going to produce red blossoms, and the gardener prefers red over pink. So what does she do? She takes the red seed, she puts it in the rich, fertile soil, pink seed over in the poor, rocky soil. 3 weeks later, she sees in her boxes what I saw in mine. In that rich, fertile soil, all the red seed sprouts, strong red seed, tall and vigorous. Weak red seed makes it halfway up. In the poor, rocky soil, the weak pink seed dies. Here comes the strong pink seed, struggling to make it to a middling height. And then in those flower boxes, those flowers go to seed. And the next year, the same thing happens. And then those flowers go to seed. And year after year after year after year, the same thing happens, till finally about 10 years later, gardener's looking at her flower boxes and she says, you know, I was right to prefer red over pink. So we interrupt the story there to say this first part of the story is how institutionalized racism works, where you had the initial historical injustice of the separation of the seed into the 2 types of soil. You had the contemporary structural factors of the flower boxes keeping the soil separate, and then through inaction in the face of need, perpetuation of the inequity. But let's pick the story back up and say, well, where is personally mediated racism in this garden? Well, the gardener's looking over at red and she says, oh, those red flowers are so pretty. And then she looks at the pink flowers and she says, oh, those pink flowers are so scrawny and scraggly. So she plucks off the pink blossoms before they can even go to seed. Or maybe she notices that a pink seed has blown into the rich, fertile soil. So she plucks it out before it can establish itself, which is some of the anti-affirmative action stuff that goes on. And where would internalized racism be in the garden? Well, the red flowers are just living their lives, enjoying being red, many of them not acknowledging or maybe even understanding that they're benefiting from enriched soil. Pink flowers are looking over at red, thinking red is mighty fine and wishing with all their hearts that they too could be red. And here come the bees, minding their business, collecting nectar, but pollinating at the same time. So here comes a bee, bzzz, into one of the pink flowers, and then bzzz, to another pink flower, and bzzz, to this pink flower, and this flower's like, get away from me, bee. Do not bring me any of that pink pollen. I prefer the red, because the pink flower has internalized that red is better than pink. So now what do we do to set things right in this garden? Well, we could start by addressing the internalized racism. So we can go over to the pink flowers and we can say, pink is beautiful, power to the pink, which is an important intervention. But if that's all we do, it's not going to change the situation in which those pink flowers find themselves. So you might say, oh, okay, well, let's address the personally mediated racism. Let's have a conversation with the gardener. Or better yet, let's have a workplace multicultural workshop for the gardener. So we do all that. And in the workshop, we say, dear gardener, would you please stop plucking those pink flowers? And maybe she will, and maybe she won't. But even if she does, it's still not going to change the situation in which those pink flowers find themselves. If we really want to set things right in this garden, what we must do is address the institutionalized or structural racism, which means we have to either break down the boxes and mix up the soil, or if you want to keep separate boxes, that's all right too, although it makes it easier for that same gardener to continue segregating resources going forward. But if we do keep separate boxes, what it means is that we must enrich that poor rocky soil until it is as rich as the rich fertile soil. And when we do that, the pink flowers will flourish. They'll be looking beautiful, grand, and glorious. So that in the intervention on the institutionalized racism, we will have also addressed the internalized racism, because pink will no longer be looking at red, thinking red is better or wanting to be red. They'll be equally beautiful. And in that intervention on the structural or institutionalized racism, we may also address the personally mediated racism. Now, the original gardener may have to go to her grave preferring red over pink, but her children who grow up and see the flowers equally beautiful will be less likely to have that kind of attitude. So I'm going to finish this story by going back to my slides, but what I have to say is that this story, it's important because it's important for us to recognize that we need to at least address the institutionalized racism. Good to address all the levels at the same time, but at least address the institutionalized. And when we do, the other levels may take care of themselves. But there's an important question I haven't raised yet, which is, who is the gardener? After all, the gardener is the one that I gave the power to decide, the power to act, and control of resources, which are actually the elements of decision-making. So who is the gardener? Well, government is a huge part of the gardener, but not the only part, because media, foundations, corporations, communities, to the extent that they have self-determination. But whoever the gardener is, it is dangerous when the gardener is allied with one group. I painted her red. That's why she prefers red over pink. And it's also dangerous when she's not concerned with equity, when she can look at her flower boxes and think that her garden is beautiful, thank you, because she's not even counting the pink flowers as part of her garden. And so our challenge is what to do about the gardener. Do we make the gardener striped or polka dotted or fuchsia? Do the pink flowers have to grow or recruit their own gardener? Lots of questions can come out of this. I just want to share very quickly 2 questions, and then I'll turn it back over to Robin. The first question that I was asked many years ago now, but now I take this question and share it everywhere I go. The question was, excuse me, Dr. Jones, why should the red flowers share their soil? And when I heard that question, I loved that question because it showed me the power of this story to start conversations about racism, which might be otherwise difficult if we were talking about racism between you and me. My answer to that question, why should the red flowers share their soil, is that actually that soil doesn't belong to the red flowers. It belongs to the whole garden. A second question is, what if that's not the original gardener we're looking at right now? What if that's the gardener's great-great-great-great-grandchild? Here we are. And that great-great-great-great-grandchild has always seen the flowers looking like that, may not even think there's a problem to be solved. So very quickly in 3 parts, to address that, first of all, we must make the differences in the height and vigor of the pink and red flowers a problem requiring urgent solution. Second, in order to make the solution, in order to solve the problem, we need to make those flower boxes transparent. We must be talking about the differences in the quality of the soil. And third, as we make those flower boxes transparent, we also need to make sure that everybody understands that the pink seed did not just launch themselves into the poor rocky soil. So we must talk about history, and we must talk about how the gardener's initial preference for red over pink, what we might describe as cultural racism, what in our society is white supremacist ideology, how that initial preference for red over pink set up the whole situation. Because if we don't talk about that part, even if we're able to compel that red gardener to enrich the poor rocky soil today until it is as rich as the rich fertile soil, if she continues preferring red over pink going forward, she will continue privileging red over pink going forward. So when I describe racism as a system of doing 2 things, of structuring opportunity and of assigning value, we need to attend to both of those if we're really going to set things right in this country or in this garden. So I would love now to get your questions. I'm going to, or, you know, Robin, back to you. And then I know I have some more slides I'm going to share. So I'm just going to stay on the share slides if I should. Oh, no, I won't.
Yeah.
I won't. I'm going to stop sharing so that people can see your beautiful face. Okay.
You're so nice. So as you can imagine, of course, you've done an excellent job as always of naming racism. And you've also touched on how racism is showing up in this, I call it the peri-COVID world that we're in, since we're definitely not post-COVID. But as you can imagine, a couple of the questions that we're seeing, people are asking, so what can we do? We get it, you know, I guess we've named it, we understand it. So how do we start to strategize? How do we get, you know, to moving this forward and really capitalizing on the momentum that we're seeing right now? So I really kind of consolidated 2 questions into one.
Okay. Well, thank you. And I'm going to share my screen again because it's important. It is not enough to name it. In fact, when I started talking about the National Campaign Against Racism, naming is the first part, but it is not sufficient. It is necessary, but not sufficient. And so in order to figure out where we should intervene first, there's a tool that I use now. It's this question: how is racism operating here? Which, first of all, is a legitimate question because racism is not a cloud or a miasma we can't get a handle on. Racism is a system with identifiable and addressable mechanisms which are in our structures, policies, practices, norms, and values, which are different elements of decision making. Where structures are the who, what, when, and where of decision making. So especially who's at the table and who's not, and what's on the agenda and what's not. And I agree. Everybody was like, that's where it is. That's where I agree when we ask that question. So anytime we find ourselves at decision-making tables, our first job should be to look around and say, who is not here? Who has an interest in this proceeding? And then our job is not just to represent their interests. Our job is to actually find them a way to the table, to create space at the table. And if structures are the who, what, when, and where of decision-making, policies are the written how of decision-making, practices and norms are the unwritten how of decision-making, and values are the why. And I recommend that we take this question with us everywhere, because anytime I'm asked to do a talk, say I'm asked to do a talk on dental care, right? Or I'm asked to do a talk on underrepresentation of people of color in research, or I'm trying to think, how is racism operating here in my child's school or in my community? How is racism operating here with regard to police killings of unarmed Black and brown men and women? How is racism operating here? You can take this question, and in 10 minutes as an exercise, you can think about the structures as the who, what, when, and where, policies as the written how, practices and norms as the unwritten hows, and values as the why, and you can generate possible levers for intervention. So I'm going to share with you how I have used this, first with police killings of unarmed Black and brown men and women, and I'm just going to flash through it because you can have these slides later. But in terms of identifying levers for action, structures, the presence or absence of civilian review boards to try to do some kind of accountability. Policies, the use or the dependence or not of grand jury systems to indict police officers. Is it enough that a police officer shot a gun, the person is dead, that you can at least indict them for murder? Or a person sat for 8 minutes and 46 seconds with equanimity and poise with his knee on somebody's neck. Can we indict that person? Do we have to go through a grand jury? So with Rayshard Brooks in Georgia, yes, we have to go through a grand jury. That did not happen in Minneapolis. Practices, the over-policing of communities of color, and the whole thing of that causing more accidental interaction, which is the basis right now for defund the police. But we need to, how can we do that? The blue code of silence, right, has been and probably still is. Police officer sees another officer doing something wrong, well, they just didn't see anything. Now, at least in some places, not only are you required to say that you saw it, you're required now in some places to intervene, right? But so these are old slides. I have to tell you, these are like 20-year-old slides, trying to do this work. So at least there's some work, the mechanisms that I've identified a long time ago, people, and there are others that I haven't identified, but people are working on them. And then on the values side, the view of Black men as inherently threatening, which makes it reasonable when a police officer said, I feared for my life. Because, yeah, it was a Black man. Wouldn't you fear for your life? Right. And then I just wanted to show the application of this also to the excess deaths of Black and Indigenous and other people of color from COVID-19. So first, I'm going to say, not just going the structures, policies, practices, norms, values route first. We need to get a general understanding of what's going on. And what's going on is there are two things that are happening. First of all, communities of color are more likely to become infected because we're more exposed and less protected. More exposed on so-called frontline jobs that are now being deemed essential, but they're not being paid as essential or any of that. We're more exposed also because we're overrepresented in jails and prisons and detention centers. We're more exposed because we're overrepresented among unhoused populations. So we're more exposed and we're less protected in all of those settings, especially in our so-called frontline jobs, and people are still not providing us with adequate personal protective equipment. But then once more infected, then we're also more likely to die because we're more burdened by chronic diseases, which comes from living in and being trapped in disinvested communities without fresh fruits and vegetables or green space or a place to walk, with poisoned air, with all of that, and with less access to healthcare to boot. And so now looking at these mechanisms, structures include residential segregation by race, which results in educational segregation by race, which turns into us being in more of those frontline jobs, right? And then the foster care system and the school to prison pipeline and all of that, that results in us being disproportionately incarcerated, where the virus is just like running through prisons, like, without control. Policies that limit personal protective equipment for low-wage essential workers and limit paid sick leave or paid family and medical leave, or, and policies that are still not giving people, hazard pay. the practices, especially at the beginning, but still of placing testing centers, not in the communities that are being most impacted, but in affluent areas, and especially in the beginning, drive-up centers and centers that require doctors off orders when many of us don't have a primary care doctor that we can just call up and say, can you order a test for me? And then testing strategies, which are still in this country, this is a big critique. We're just testing symptomatic people for the most part still, especially in workplaces, screening for temperature and then a test. When we know that between 20 and 80%, and so the rough number that we might use would be 25%, at least 25% of people with this virus who are spreading the virus have no symptoms at all. Well, when you do that, that's causing the virus itself to spread throughout. And then when the virus is spreading throughout and we're still overrepresented, it's impacting us as well. Norms of racism denial, which is supported by lots of things, by the narrow focus on the individual, which makes systems and structures invisible or irrelevant. Our ahistorical stance as a nation, which acts as if the present were disconnected from the past. And the myth of meritocracy, that if you work hard, you'll make it, which blames people who haven't made it as lazy or stupid. I'm going to go into more detail on those things. But just to finish this piece, the values and the way that we differentially value human life in this country, which is being baked in to the so-called crisis standards of care, those guidelines that when we have local scarcities of ventilators or emergency dialysis or ICU beds, then the usual physician-patient family relationship is going to go out the window. And if there's one ventilator, they're going to be looking at these rules for who of those 5 people who need a ventilator get one. And that's when the values and the hierarchy of human life on many of these things are going to come into play. And skepticism about lottery as a rationing thing, where I actually think lottery would be actually the best way for us to honor principles for achieving health equity if we have to have some kind of rationing of scarce resources. So I'm going to stop sharing here. And Robin, I think you might have another question, or if you wanted to combine it. Do you have one more?
I think we have time probably for one more. And then we'll check our time. I think we only have time for one more. This one has been raised. What are some good examples of places where you have seen these issues be addressed? Maybe not solved, but at least start to be addressed.
I think that, so first of all, I will say that there are now 2 states, 21 counties, and 23 cities at the last time that I looked that have named racism as a public health crisis. They've done the first part. That is, these are jurisdictions. It's not the health department of. These are the city councils, the county, councils. It's the state governors doing this. And so the American Public Health Association actually has a website where you can go, and I'll send that as a reference, where you can look at these places. That's an important first thing, because at least they're putting a stake in the ground. They're taking public accountability for what are they going to do next. It's one thing, what they're saying is, we saw the 2-sided sign and we know it's 2-sided, but it has to be followed up by action. King County in Washington State is doing a great job for a long time on all of these things. Milwaukee County and the city of Milwaukee County was the first out of the gate in 2019. No COVID, no, of course there were all of these deaths by police violence, but not the public outcry, with George Floyd. 2019 said racism was a public health crisis, and then don't you know, it's no accident that they were the first ones to release their COVID-19 death rates and infection rates by race ethnicity. It's no coincidence, because they knew racism was a public health crisis. So now here comes COVID. It was like, oops, we better check and see what's going on with differentially by race. It's no accident. So it's an important first step. It makes people have the eyes to see, but then the action has to follow. But I would say, looking at King County's declaration, as I read through that, and what they were talking about doing was amazing. Do I have time to share a few more slides, or are we cutting off at exactly 11:15?
We are not cutting off at exactly 11:15, but you can share a couple more.
Just a couple more. Just a couple more.
Final statement, and then we'll start to wrap up. Yes, ma'am.
Okay. Yeah. Just a couple more. So hold on, because there was just a little something that I wanted to share. I'm almost done anyway. I'm going to go here to this definition of health equity. So I just need to say this because the whole thing is, health equity, the urgency of now. So I would be really bad if I'm trying to set up the whole series and I didn't talk about this. Here's a 3-part definition of health equity: what it is, how is it relate, how do we get there, and how is it related to health disparities. So I define health equity as assurance of the conditions for optimal health. That's because I recognize health equity as a process. Healthy People 2020 says health equity is attainment of the highest level of health for all people. I agree that's our goal, but my problem with that is the definition of health equity is, what if we hit that last Sunday? Are we done? And we're not. So I think health equity is not an outcome, it's a process. Which process? Assurance, which is one of the 3 core functions of public health, along with assessment and policy development. Assurance of what? Of the conditions for optimal health, the living conditions, educational conditions, the all kinds of conditions for optimal health. For whom? For all people. That's what makes it equity. How do we get there? Achieving health equity requires at least these 3 things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. And in the poll, I was very interested that 45% of you thought that recognizing and rectifying historical injustices is the most important thing. I think you're right, because our denial of racism is entirely ahistorical, and reparations are going to be part of what we're going to need to do. And then there was almost even split between the other 2, valuing all individuals and populations equally and providing resources according to need. The hardest one, well, they're all doable, but they all take commitment. They all take a commitment to achieving health equity. For anybody listening to this webinar who wants to ask, is my work taking us, am I contributing to achieving health equity? Use those 3 principles as a checklist and see how you're doing. And then, how is health equity related to health disparities? Health disparities are the differences in outcomes. Those will be eliminated when health equity is achieved. And I was going to say that these principles are the most important part, and I was going to operationalize this. I will leave it in the slides, but I'm not going to take time right now. You can read this in the slides. I just wanted to say that there are 7 societal or cultural barriers to achieving health equity. I now recognize these as the values targets for our work. They include the narrow focus on the individual, which makes systems and structures invisible or irrelevant. And also, they limit our sense of what can be done, because you're thinking, well, what can I do about racism? When in fact, we should be thinking about what can we as a collective do about this. The ahistorical stance: not only do we act as if the present were disconnected from the past, but we act as if the current distribution of advantage and disadvantage were just a happenstance. The myth of meritocracy: if you work hard, you'll make it. I give you that most people who have made it have worked hard, although not everybody who's made it has worked hard. But most have. We have big examples of people who've made it who haven't worked hard. I'm not going there. But just as most people who've made it have worked hard, there are many, many other people working just as hard or harder who will never make it because of an uneven playing field, which has been structured by racism, sexism, heterosexism, and all of these other systems of structured inequity. And when we deny racism, then we are endorsing the myth of meritocracy, and there are many ways to deny racism. One is to say, I don't think racism exists, thing of the past, irrelevant, excuse, right? As some, those were some of the things when I asked you, what is racism? But another way to deny racism is to never say the word racism. So you might be talking about implicit bias or unconscious bias or diversity, equity, inclusion, cultural competence, disproportionalities, disparities, all of these important things to talk about, even race. But if you talk about all of those things and you never say the word racism, in the context of widespread denial of racism, you're complicit with that denial. Quickly on these other barriers, the myth of a zero-sum game, the myth that if you gain, I lose. It's like people think that they're having this potluck dinner. They don't want you to come to the table because they think you're going to eat up all the food. They don't recognize you're bringing with you pies and cakes and roasts because they have devalued you. They don't even understand what you bring. The fact that we in this nation have very limited future orientation. The parts of the future we can touch right now are the children and the planet. We do not have high regard for the children. We don't think about 7 generations hence, as many American Indian nations do in our policy making. We do not ask how are the children, as many East African groups do. Maasai people, instead of saying, hey, how you doing? When they meet each other, might say, how are the children? And they hope you're going to say all the children are well. We don't even ask how are the children. And if we did, we would not get the answer that all the children are well. And we have a usurious relationship with this planet. The myth of American exceptionalism makes us not even want to look at others to learn something. And this is so apparent with COVID-19. Oh my God. And finally, the seventh of these barriers, which is actually the first, is white supremacist ideology, the Gartner's initial preference for red over pink. And some people think that that term white supremacist ideology is inflammatory, but here's just what it is. White supremacist ideology is the false idea that there is a hierarchy of human valuation by race, and the falser notion that if there were such a hierarchy, that white people would be or are at the top of it and are the ideal or the norm. But this white supremacist ideology gives white people a sense of entitlement. It results in the dehumanization of people of color, which we saw with the murder of George Floyd, of Rayshard Brooks, all of this. What is going on here? And it also underlies the fear at the browning of America, which is underlying our present political pickle that we're in right now. So basically, what can we do today? We should look for evidence of two-sided signs. Is there something differential going on here by race, gender, education? Is there something differential going on by language, by immigration status, et cetera? We need to burst through our bubbles to experience our common humanity. Each of us lives in a bubble of experience, and often we don't know that just across town there are people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances. We need to burst through our bubbles and experience our common humanity in different circumstances. We need to be interested in the stories of others. And then once we hear those stories, we need to believe the stories of others. And then when we believe, we need to join in the stories of others. And I think I'm heartened at so many of the mobilizations, the protests that we're seeing right now, that I think that people are being interested, believing, and finally joining in the stories of others. We need to develop a sensitivity to the absence of who is not at the table, what's not on the agenda, what policies are not in place that if put in place could be excellent. And we need to recognize that structural racism most often evidences itself as inaction in the face of need. So we need to reveal inaction in the face of need. But all the actions are not just on the side of the people who are inside the restaurant. Those of us on the outside need to know our power. We need to recognize that action is power, and especially that collective action is power. So thank you very much. I'll stop sharing my screen and let's go.
Thank you so very much, Dr. Jones. And as you can imagine, everyone would love for you to go on. And there has been a note that let's take this talk national. So I'm sure you've heard that before. So just to put that out there as well. But thank you so very much again for your time, for your wisdom as always, and for the great work that you do and that you will continue to do. And I hope everyone out there who has bared with us, we thank you so much for that. Just to understand, Dr. Jones, we will be sharing as much of her resources as we can. You will definitely see her again, and we will take your questions that we did not get a chance to answer. We will certainly work with Dr. Jones to get those answered and get those out to you. This has been recorded. We will definitely share the link again with those resources as well as the questions that you've posed, all of which are very good questions. And I'm sure Dr. Jones will have awesome answers to. But I really, again, along with thanking all of our participants for being with us and being here today, thank you so much to all of our partners, to the planning team behind the scenes, all the flurry of texts and chats, the Just Health Circle, the PSC staff, in particular, Andrea and Rachel, everyone for making this happen. But I also want to say that this, again, is just the kickoff of a series. This is the very beginning. We will continue this event. We have 3 more, and they will all eventually, in over time, get to strategies and really zero in on what we can do to address the things that Dr. Jones has raised. Our next event will be July 30th, and it will center around educational equity. We have Dr. Robert Hahn as our speaker. And we will also, I believe, we were going to share some evaluation questions. If we don't share them here now, you'll definitely get those afterward. But again, thank you so very much. If you all want to join the Just Health Circle, it's a great group to be a part of. Shameless plug. Please reach out to Arlene Parker Goldson or Andrea Hickson, and you will get their email addresses in what we send as well. So again, thank you all so very much. Please continue to stay safe. Take care of yourselves. COVID is not over. Wash your hands, wear your mask, vote, and be safe. Take care of yourselves and each other. Thank you again. Thank you so much, Dr. Jones. Everyone have a great day. Thank you.